very senior colleagues, friends, and associates. I have been introduced as a doctor, but today I stand here as a budding environmentalist and very passionate about the environment. And in the course of studying the environment, I realized that there's no good health without good environment. It's just impossible. And the correlation between health and environment is directly proportional. I'll just talk through the presentation. It's nothing hard. I believe most of us here understand medicine, so I'm going to focus more on the environment. Now, the impact of emerging infectious diseases and how it affects environmental degradation. What exactly is environmental degradation? Degradation is like spoiling. When we start to affect the environment with our activities, what we do, it could be anthropogenic, meaning man-made. Next slide, please. Anthropogenic, man-made activities, deforestation, urbanization, excessive agriculture, industrialization, and we also have things that happen naturally, like earthquakes, volcanoes, floods can be both anthropogenic and natural. All of this lead to environmental disintegration. Then there's deterioration. When we continue to degrade, we start to deteriorate. Degradation at times we can fix. Degradation at times we can remediate, that means repair. But when something starts to deteriorate, that is what we are calling global warming and climate change. All the things we're doing to the environment is leading to global warming and climate change. And how do these things affect us, human beings? How do they affect our health? How does it affect even non-living things? How does it affect animals? From this slide up here, it's just very clear. When we look at human activities, this Lagos, for example, I used to live in Omole Estate, and I remember someone telling me that 60 years ago, it was a forest where people used to hunt for animals, bushmeat. It was closer to expressway. So when we start to expand and move into the natural territory of animals because of urbanization, which is necessary anyway, we start to play with something called zoonotic diseases. I'm trying not to be a doctor, but zoonotic diseases are those diseases that are transmitted from animals to man. Animals are natural carriers. They transmit to man, and it is very easy for man to transmit to woman, to child, to friend, to foe. And that is what happens when we start to encroach on the forests. What about land and water and all our biological resources? I would not like to say Dubai or a co-Atlantic city is something that shouldn't be done, because they would have done an environmental impact assessment. I do hope so, that somebody reviewed the impact of that on the environment. But when we start to claim water, when we start to disturb the fauna and flora of our water systems, then we start to have problems with our food chain. And when we don't eat well, we start to become sick. I'm just trying to stick to environment and what it causes us humans. When we don't protect our environment, the economic losses, the social losses, even the I've been asked to talk about communicable diseases, but I would like, since I'm an advocate of mental health, air pollution with noise pollution actually causes psychological problems. It causes mental health issues. That's why I'm wearing this badge that says break the stigma. People can have mental health issues due to factors that are beyond them. Environment. No good environment, no good health. Please come along with me on this little journey. Now, there are key environmental outcomes. Outcomes mean, key environmental outcomes, like what do we expect to see? What are the things that damage our environment and lead to global warming and climate change? We have unplanned urbanization. I have spoken about that. When we just go, when you get to Ekpe, somebody decides to put a village by the water, and all the activities of the beach and the music and the vibrations chases all the fishes away. A study was done in one of, I think Ilashe, or one of those fancy beaches out there. Because of our human activities, the barracudas are moving further away into the ocean, and they do not survive in the ocean. They are shallow water fishes. This affects the economy of such areas. People that fish to sell, it's a problem. And people that fish to eat, they start to suffer from malnutrition and decreased immunity. And these are all things that make us susceptible to emerging infectious diseases. I won't pay much attention to this because I have said about deforestation, even bushmeat trading. When we go after bushmeat, those things, a lot of them, are natural carriers of diseases or of viruses, of pathogens that do not harm them. Especially those ones, bats. I don't know if people eat bats, but I have heard in China they eat bats. And corona has been linked to bats. But I am talking from a Lagos perspective. I doubt if Lagosians eat bats. But some of those other animals we eat have interacted with bats in the forest. So we can't say, oh, I don't eat bats, I don't know bats, but I eat bushmeat, I eat pangolins, and it is okay. All these things have a massive impact on the health index of any developing nation or city. Now, the current picture in Lagos State, I don't have to say. Before I talk about the current picture in Lagos State, let's look at this slide. It just shows everything I've spoken about. When we build dams, canals, and we do irrigation, for the doctors here, the diseases that come with it are clear. Waterborne diseases, malaria, schistosomiasis, river blindness. Let's go all the way to deforestation, ocean warming. When we have elevated precipitation, that is when the temperature of the earth is so high that water starts to evaporate. This water evaporating is carrying with it particulate matter, is carrying with it bacteria, is carrying with it viruses, is carrying with it pathogens that cause infectious diseases, and we breathe it in. That's a direct relationship between fiddling with the water system, in fact, with the ecosystem and our health. Now, the current picture in Lagos State. I don't have to explain this. Let's just use corona. Look at this hall. We're all wearing these things. We greet each other in different ways. Economy is bad. As a regulator in LASEPA, I find it hard to even The entertainment industry is dead. People have borrowed money to start bars and restaurants, and all of a sudden there's corona. Nobody wants to go out there. WHO recommends an acceptable minimum. There's something called particulate matter. I'm talking about environment now. In the air, when we see the air, it should be transparent, like here. We shouldn't be able to smell or see anything. But some of those things we don't see are so small that we breathe it in and it can pass through our lungs to the rest of our bodies. And this is when we start to have diseases like bronchitis, pneumonia, and Legionnaire's disease, and all sorts of things that are due to air pollution. Now, how do we manage a novel disease such as COVID-19? Let's look at what corona has cost Lagos State in terms of human business, in terms of human resource, in terms of mortality and morbidity. I'm sure there's nobody here who doesn't know of someone or has heard of someone that died of corona. That didn't have to be. And it's a bittersweet story for the environment sector. During corona, Lagos as a city, had one of the best air indices in the world. We were on number 1, better than UK, better than New York, London, Frankfurt. And why? There was a complete lockdown. There's something called source apportionment that we do in environment. Where is air pollution coming from in Lagos? What is our greatest pollutant in Lagos? It's from traffic. In industrial nations, we find out that it's from industries, air travel, manufacturing. But here in Lagos, it's from traffic. And what do we mean traffic? A car is not supposed to pollute the air. But when cars are standing bumper to bumper for 2 hours, 3 hours, the concentration of carbon monoxide starts to rise. When cars have not been serviced adequately and you are not completely combusting fossil fuel, that's when they say a car is smoking. That smoking is a killer. We continue to breathe it in, and this affects our health. Up until corona, it wasn't clear. At the beginning of corona, it wasn't clear how the quality of air affected corona. But in no time, scientists and professors found out that the poorer your air quality, the poorer your prognosis. The poorer your environment indices, the poorer your prognosis of surviving corona, and the higher the risk of spreading it. When we have rapid urbanization and people are moving into Lagos, I've heard of places where they say 5 people share a room. Infectious diseases will spread like wildfire in such places. It is still related to our not concentrating on the environment. Lagos has lost a lot. We have lost human resource, we have lost capital, we have lost money, we have lost skills to corona. And for us, I like the lecture we had on the first day. I was very, very happy when the man from the Navy was talking about how from years past, people understood that dirty water is a weapon of war. If dirty water is a weapon of war, and you can put decomposing corpses in water just to poison your enemies, how about ourselves? How about ourselves? Microplastics, macroplastics, all these things Plastic pollution, we keep shouting, stop the use of single-use plastic. All of you are thinking, how does it affect me? That's environment and global warming and climate change. So I'll tell you very clearly that the microplastics, I'll stand a little bit away from infectious diseases and talk about something very dangerous, cancer, that has no cure. Those micro things, planktons and small things in the water, they swallow it. Small fish eat planktons and plants. Big fish eat the small fish. And we all here eat the big fish. There's something called bioaccumulation. The more we continue to do this, the more microplanktons we have, and then somebody comes down with cancer and they say, oh, he was a vegetarian, he ate well, he only ate fish, he never smoked. How about your exposure to air pollution and infectious diseases? Even corona with air pollution is they are twin killers. If you're exposed to particulate matter less than 2.5 and you have corona, you need to be very careful. And what are the impacts of environmental degradation really? A World Bank study in 2017 told us that air pollution resulted in about 11,200 premature deaths in Lagos State from doing retrospective studies, just air pollution. What am I saying? Let us start to pay attention to the environment. The socioeconomic impacts I don't have to talk about. Just think of corona and what corona has done to our economy. Now, this next table just says, the next slide talks about the state of play. We can substantially reduce and possibly eliminate what is going on by being proactive. I also like what was said on the opening day of this conference about how we are preparing for the fourth wave. That is what is called sustainability. That is what makes a city livable. How do you react? How do you face when a pandemic, let me just call it a pandemic, when a pandemic faces you? I am very happy and I'm pleased to be part of the health family who has done a fantastic job for this nation, not only for Lagos, in curbing the spread of corona. And I believe that fourth wave, with this conversion, we will conquer it. I didn't say in Jesus' name, it's from work, hard work. And that takes me to the One Health paradigm. There's no way we can fight all these things I'm talking about if we don't have medical professionals, veterinary professionals, environmental scientists, ecologists, geographers, economists, all of them come together and start to think that what are our touch points and what are our pain points. And I'm very happy that the Ministry of Health has come up with this One Health project, and environment and agric are very, very active in it. And I don't know if we can see that cycle very well. We see animals, we see human beings, we see hunters, we see doctors, we see dogs, we see even non-living things. That is the idea of the One Health project. We all have to come together to fight this war against emerging infectious diseases. And when we say emerging infectious diseases, it means basically that some diseases that have been there in the past, we thought are gone, or are latent, just quiet there, and all of a sudden, boom, we are facing an epidemic or a pandemic like corona. If we had all worked together under the One Health paradigm, I believe that the world would have had better outcomes with corona. What have we done in LASEPA towards a better environment? I've said I am here as an environmentalist, not as a doctor. We collaborated with World Bank, and World Bank was able to give us 6 air quality monitoring machines, and the findings of these machines cannot even be published and cannot be said publicly until we have a plan to mitigate the effects of air pollution in Lagos. But we have started advocacy, and we are starting to change people's attitudes. We're sharing knowledge here. I am telling all of you that global warming and climate change is not a futuristic thing. It affects our children, it affects us, it affects you and I. Cholera, for example, is directly proportional to how we treat the environment and the aquifer and the water system around us. If our water is pristine and clean and our food, cholera will be eradicated. That's a fact. But how do we get our water to be pristine and clean and portable? That is left not only to the Ministry of Health or Environment. It is a joint effort under the One Health paradigm. We have also started talking about using eco-friendly fuel. One of our buses we converted to gas from burning petrol and diesel. Let's see what happens with gas. But we cannot put out a policy that everybody starts to use gas when gas is not widely available and widely affordable. It is the government's duty to make sure that before we put out any regulation and enforce it, what we are asking you to do is there, affordable, probably even subsidized. Kenya was able to ban single-use plastics, and it took them 6 years because all the manufacturers of single-use plastics were not thrown out of work. The government started giving them machines and technology to make biodegradable plastic bags. The government spent a lot of money. There was political will. The health impact of micro and macro plastics was spread all over the place, like how health did during the advent of HIV/AIDS, scare tactics, and it worked. And I believe we need to start to do that in Lagos. If people knew the amount of damage these bottles do when they land in our drains, the amount of floods it costs, the amount of children that are swept away because of blocked canals, we will start to know how to manage plastics better. So in LASEPA, we are hot on advocacy, we are hot on information, education, and not just a one-way talk, we are also very hot on communicating. And you know, we have used the strategy of saving the environment to say that save the environment, live a better life. Save the environment, live a better quality of life. Because we realize that human beings really, in the end, what concerns us is we are born, we want to eat, we want to make money, and we pray not to die till we're old. We just ignore the space that we met here. A famous actor whom I like very much, well, I like the movie he was in, Titanic, Leonardo DiCaprio, said, our generation, those of us here, are the first generation, is the first generation to pay attention to global warming and climate change. And if we do not aggressively spread this message to the next generation and within ourselves, we will be the last. And that is doomsday. That takes me to this. Sorry. I want my last slide, please. Yeah, this game. It's a very dangerous game. I don't know if any one of you have heard of, I've forgotten, what's the name of this game? Where you try and remove Jenga. So it's played like this. You try and remove building blocks and make sure the whole thing doesn't collapse. You remove one, I remove one. You remove one, I remove one. Let us look at this slide very carefully. The bottom part in the Jenga game is the most crucial part. If we remove things in the bottom, the whole plank would collapse like a pack of cards. And what do we have at the top of the board? Human beings. What do we have at the bottom? Please, can anybody see?
Mushrooms. Mammals. Fish. Reptiles.
Insects. In fact, let me tell you something very funny. I hate flies, and I used to wonder before I went into environment that why did God create flies? They're so irritating. But flies are very, very important in the ecosystem. Very, very important. Because if we do not have flies, that degradation we are talking about and things being biodegradable, it will not happen. Another example is pangolins and soldier ants. Pangolins is widely consumed in Lagos State as bush meat. Pangolins feed on soldier ants. Think about removing all the pangolins from all our bushes. And think about soldier ants entering Alausa and everywhere. And then we say it doesn't affect us. I eat bush meat. Those environmentalists are saying their own. Everything is interconnected. So if we start to remove those small things from this Jenga game, who suffers for it at the top? Who?
Okay.
That is all of us. I close this presentation by saying the One Health paradigm and intersectoral collaboration is the key to tackling emerging infectious diseases. And we pay extra attention to the environment we live in. Thank you very much.
Fantastic.